Good morning. My name is Keegan Warren-Clem, and I am an attorney directing People's Community Clinic's Medical Legal Partnership, a collaboration with Texas Legal Services Center. Where we live, grow, work, play, worship, and age affects our functioning and our quality of life greatly. And the way that society shapes those spaces is through law. And so my team of legal professionals helps patients with their health-related social needs. This is because law affects our ability to be healthy. Today, I'm going to talk about one law in particular that is causing some people to be scared to get help with their housing, their food, and their medical needs. And these are all critical to good health. So that law is the public charge test. The public charge test is a long-established law that says that certain forms of immigration relief are not available to people likely to become dependent on the government. So the thing that's changed recently is what that phrase means. But before we talk about what it is now to be determined to be likely to be dependent on the government, we need to talk about who is affected. That's important because it's actually a relatively small number of people. So first, someone who is seeking to become a legal permanent resident. So in common parlance, we call this getting a green card. The second group of people who are affected is someone who is seeking to extend a non-immigrant visa, like a work visa or a student visa or a tourist visa. And then finally, those who are seeking to come to the United States lawfully. Now, this almost always means people who are not currently in the United States. And so we can almost forget about that category, at least as far as kind of things go day to day. But I say almost because if a green card holder leaves the country for more than 6 months, then they actually have to reapply for admission, and that reapplication for admission can trigger the public charge test. And this means that travel abroad for green card holders should be done strategically. So the new public charge test takes into account a number of factors, and it weighs those to determine if someone is likely to become dependent on the government. These include things like health status, whether or not the person has private health insurance, how much money the person makes, their age, their work skills, their English language skills, and use of certain public benefits. Now, importantly, this is a balancing test, not an absolute. And that means that negative factors can be outweighed by the positive factors. And that's really important to understand. Now, the first 6 here are pretty straightforward, but that last one is the one that I think is causing the most confusion. So I'd like to focus on it. To understand the confusion, it's helpful to talk about the old rule, which had taken effect in the late 90s. Now, the old public charge test applied to just 3 benefits. It was SSI, or Supplemental Security Income, which is one of the 2 disability programs under the Social Security Administration. SSI is available for people without an adequate tax history. So we're thinking about adults who haven't worked very much or who haven't worked recently, or for children. Second, under the old test, was TANF, the Temporary Assistance for Needy Families. This is kind of what we used to call AFDC or welfare. It's a cash benefit, but it's not a whole lot of money per month, less than $100 in Texas, and it has a lot of hurdles, so we actually don't have a lot of Texans who get this benefit. And then third, under the old test, was long-term care Medicaid. This is the type of Medicaid that pays for nursing home care for almost everybody in the US. And that was it. And so the best practice was always that every family should weigh their needs today against the possibility of problems down the road. Well, why is that? So first, the old public charge test was practically never used to deny an immigration application. And so in some ways, it was much more like a policy than a law. But even if it had been used to deny an immigration application, without food and shelter and medical care when you're sick, your immigration status is less likely to matter later on. Now, the other thing to remember, and I'm going to say this over and over again, is that the public charge test, whether old or new, applies only once a person turns in an application for one of the three things that I mentioned: to get a green card, to extend a non-immigrant visa, or to come into the United States. That means that if you're not doing one of those three things, the test does not come into play. Now, the other reason that people have been so confused is that in spring 2018, the Trump administration leaked a memo that said that they were going to expand the list of public benefits. Now, that in and of itself might have been okay, but the benefits they said they were going to add was a lengthy list. And so that got a lot of attention because this list includes practically every way that we pool our resources to make life better for all of us. And under the old test, all of these had been fine. And so people were worried. But about 6 months later, the proposed rule was actually published. And this is what it looked like. Very different. So I think it's important to talk about what was proposed, what was threatened, because it explains why a lot of people are confused. The other reason that I think that it's important to talk about the benefits that are not included is because it gives us a chance to be expressed, that the things that are grayed out on your screen, those are off the table. Those are resources that it is fine for anyone, including immigrants, to use. Now, there are three things that still remain on your screen, and we need to take a look at those benefits because there's actually some really important carve-outs. So putting all of this together, the old rule plus the new rule gives us a pretty short list of benefits that you need to think about. It's SSI, it includes TANF, and it includes Medicaid, but not Medicaid for children and not Medicaid for pregnant women or new moms, and not emergency Medicaid and not Medicaid for school-based services. It also includes food stamps under the SNAP program, as well as subsidized housing. But again, this matters only once you actually turn in that immigration application. So this new rule began on February 24th of this year, and that was the early stages of the pandemic. Many people worried that the rule would cause certain folks to avoid getting tested for the new coronavirus. And so the Trump administration added some more exceptions in order to address what by that time we knew was an immigrant hesitancy to seek medical treatment, to get preventative services, and to rely on programs that helped them meet their housing and food needs. And so those exceptions mean that the public charge rule does not apply in any form to COVID-19 related medical care, even if Medicaid pays for it. The rule also can be waived for people who lose their jobs due to COVID-19 and then need to rely on public benefits. But I would recommend that anyone in that situation make sure that they keep all of their documentation. So how much use of public benefits counts? Well, any benefit that is used for more than 12 months in any 36-month period is potentially going to be weighed negatively. Now, it's important to note that each benefit counts separately. And so if two benefits are used in 1 month, that 1 month becomes 2 months. Any benefit that is being received when the immigration application is turned in may also be weighed negatively. But importantly, it is usage by the individual applicant that counts. And so in other words, a child's benefits do not directly affect a parent's immigration application. And so that means, for example, that if a kiddo needs to see a specialist and uses Medicaid to get to that specialist, that's okay. So what can we do to push back to help stop these kind of laws that we know are bad for health and we know interfere with access to care? Well, one option is to fill out the census. The census, you might say, why does it matter? Well, it actually matters for health a lot. In fact, it turns out that the census brings over $59 billion a year to Texas for community programs. This includes things like where we live, where we get our medical care, where our kids go to school. And it also makes sure that our highways are safe and that we have enough services like firefighters and so many more things. So what is the census? Well, it's just a count of all of the people that live in the United States. We do this every 10 years, and it's regardless of citizenship status. The census includes very simple questions about your age, your sex, your race. So you're not going to see things like questions about your social security number, about your income, or about your citizenship status. And the information is safe. Responses to the census are confidential and they can't be shared with or used by any other law enforcement agency. This includes organizations like the IRS, like ICE, or like the local police. And in fact, Census Bureau employees take a lifetime oath to protect the personal information of every single respondent. So how do you interact with a census worker if they come to your door? Well, first, if you go online or pick up the phone today, then it's less likely that any census worker will ever come to your door. But if someone does come to your door and you speak a different language, you can ask to have a census worker who speaks your language come visit another day. And once someone does come, it's important to check their ID, make sure that it has their photograph, make sure that it has a U.S. Department of Commerce watermark and an expiration date. If you're not home or you don't answer the door when the census taker visits, then they'll leave a note, and that note will tell you how to respond online, by phone, or by mail. We'll talk about those in just a moment, but I also want to note that if you don't respond, then your data won't be captured accurately, but the government will still put data for you. So by now, you've likely received the census by mail, and you can use that form to fill out the survey, or you can take the code on it and go online to 2020census.gov. You can also get that link by texting Respond Now to 313131. And lastly, you can pick up the phone and call 1-844-330-2020. If you speak another language or are deaf, then make sure you use the appropriate number. So thank you for joining me today. I look forward to answering your questions. All right, so we have several questions coming in. Keep them coming. So one question that I see is how you can be sure that the person at your door isn't posing, isn't someone that they say they're not. And all census workers carry an identification card. That card will have their photo, it will have the Department of Commerce watermark, and it will actually have an expiration date as well, so that you know that this doesn't go beyond later this fall. So another attendee asks if she says, if I live in Texas, is it okay for me to use SNAP benefits? And the answer is it depends. If you are turning in an application to get a green card or to extend a non-immigrant visa, then and you use SNAP benefits, then that could be a negative factor in your application. The second part of that question is what other benefits are okay to use under the new public charge rules? And the answer to that is really anything that's not SSI, that's not TANF, that's not long-term care Medicaid or Medicaid for the disabled. So not Medicaid for pregnant women, not Medicaid for children, not Medicaid for school services, and not long-term, not emergency Medicaid. And so if it's anything else, like MAP, for instance, which is a local health plan that we have here in Travis County in Austin, that's fine. That's not going to be a negative factor on your immigration application. So another question here is, what can healthcare professionals do to advocate around these issues to better protect our patients and communities? I think the first thing is to make sure that you're informed. This is a really great question because there are so many of us that are working with people in the community, and understanding these rules means that we can give good guidance to patients, to other people that we advocate for in the community. I think the other option is to think about ways that you can be engaged. Things like filling out the census do actually make a difference, but so too does voting, which gives me a chance to say that the deadline for registering to vote is coming up. So if you haven't registered and you are a citizen, you are eligible to vote, then I would very much encourage you to take those steps before October 5th in order to vote in this November's election. So another question that I see is, when should I not use benefits under the new public charge rule? So remember that the public charge rule doesn't swoop in from nowhere. It only comes into play once you are turning in one of those 3 types of applications that I talked about, right? Once you are trying to actually turn in your application to extend your non-immigrant visa, or once you are turning in your application to get your green card. Otherwise, you really need to weigh your needs now versus the chances that this will be a negative factor in the future. So you can keep the questions coming. There's some lively conversation about voting, and I'm really excited to see that. It is so important, even if you're not passionate about a particular candidate, recognizing that our executive branches appoint judges, for instance, and that might impact your life. Means that sometimes our vote isn't just about the candidate, it's about the policies, the judges, and the impact that they have on our everyday lives. Okay, we have just a moment more left. And so the question is a good one. It says, when is the last day we can fill out the census? The answer is September 30th. That is the target deadline. It's been a little bit of a moving target because of the pandemic, because 2020 has been an unusual year, but that is the current plan, September 30th. So go online and fill it out. Yeah, I did it a couple months ago. It only takes just a couple of minutes. Oh, this is a great question. I know I said that was the last one. Can someone be deported by taking the census? The answer is no. And the interesting thing about that is that census workers, if they were to reveal that information, that someone wasn't a citizen, for instance, they can actually go to jail for up to 5 years, and they can be fined up to $250,000. So that's not a law that you want to violate. This one's good too. If I'm applying for asylum and my immigration lawyer says not to use any government benefits, is that correct? And the answer is no. Unfortunately, there really is a lot of confusion and a lot of misinformation out there. And the application for asylum does not trigger the public charge test. Another one that people often ask about is the application for citizenship. That doesn't trigger the public charge test either. It's only extending the visa, coming into the United States, either because you already are abroad or because you've been there for more than 6 months. I've completely lost the third one, and getting a green card. All right, so I'm not seeing any further questions. Okay. Well, in that case, I'm going to sign off. I thank you for joining me today, and I look forward to hearing any of your other questions that you might have. I'll be happy to answer those offline. Take care.